Let's bring in President Trump's former chief medical advisor, Dr. Ronny Jackson. He's also running for Congress in Texas. Dr. Jackson, I'd like to ask you, what do you make of all these asymptomatic patients we're seeing now?
Well, I think, Grant, that there's an effort underway right now, unfortunately, to manipulate the numbers again for political reasons. And it's not only what you're talking about, where that denominator is going to be a lot larger than we're being led to believe. But I think also, in my opinion, some of the deaths that are being attributed to the coronavirus right now are not directly due to the coronavirus. That the fact that someone has a coronavirus is an incidental finding in someone who died from another cause, or it's a presumptuous diagnosis and they actually weren't even tested to prove that they had it. So there's a lot of manipulation of the numbers going on right now. I think some of that's for political reasons. There are certain jurisdictions that are, going to get a lot of money based on the number of deaths that they have. And then, of course, we got the mail-in voting issue going on and all this kind of stuff. And I think the liberals just hoping that they can keep the economy down until closer to November so they can potentially get the presidency back.
I'm glad you raised the issue of everybody dies of COVID-19 now. It seems like nobody dies of natural causes anymore, including 94-year-olds who had all kinds of underlying conditions. And then they say, well, they appeared to have symptoms of COVID. They're putting that on the death certificate.
That's right. Yeah, it's disturbing what's going on to some extent. I've heard people report that people have died, basically from injuries sustained in a car accident in the hospital a few days later, and because they're testing everyone in the ICU, these people incidentally tested positive for COVID-19, but obviously they died from the traumatic injuries of the car accident. People are dying from heart attacks and other things that they would normally die from, and these are incidental findings, like you said, they're just presumptuous diagnosis.
So let's talk about the importance. You've had studies coming out of prisons. We've had studies from aircraft carriers, from not just the United States Navy, but other navies where the infections were a very high rate. And they're showing upwards of 60-70% of the people, including a couple counties in California, that showed no symptoms at all, which means the death rate plummets. Why are we not taking this into account when we're pushing all these lockdowns?
I'm telling you right now, I think there's a lot of political, it's being driven by political interest right now to some extent. And, no one wants to minimize the potential, risk to certain populations, like the elderly population, those with pre-existing conditions. But, the reality is that this is going to be a lot lower mortality rate than has been reported for a long time now. And there are even new studies out now that are indicating that this may have been around since early last fall, so we just don't know what that denominator is, but I promise you it's going to be a lot bigger than it's being reported to be right now. And the mortality rate is going to be 0.1% or less when this is all over and done with.
Yeah, which is much less than they've been telling us for a long time. Everything seems to be not quite what they were telling us in the beginning. It was all about flatten the curve for so long. Then they moved the goalpost. Now we need a vaccine. Now, the president has done a very good job, and I believe he's going to be on track with this Operation Warp Speed that he announced yesterday to get a vaccine within 12 to 18 months. What do you make of that push, and what's the reality they get it done?
I think it's great. I think the president's shown incredible leadership on this. He's really saving our country right now. He initially did what he had to do when we didn't know anything about this disease and was pretty aggressive in his posture towards it. But there comes a point where, this flattening the curve has become finding the cure. And there are people out there advocating they don't want to open our country back up or get our economy back up and running until we find a cure. And that's just ridiculous. That's not going to happen. And that's what happens whenever you let I'm speaking as a physician here, but when you let the physicians who are immunologists and public health folks and things of that nature, when you let them drive the train, it's going to migrate towards finding a cure before they're comfortable allowing our economy to open back up. And the president has set that aside, and he's put the economic task force kind of in charge right now, and they're leading this forward. And this Warp Speed program is going to be great. I mean, it's taking advantage of the president's efforts to combine the federal government, academia, and the private sector to rapidly come up with a cure for this or a vaccine for this disease, and it's going to work out well. Go ahead.
I believe it's going to work out great, and I appreciate your service to the country, all you did in the White House, taking care of multiple presidents, not just President Trump, and God bless you for that. Good luck in your race in Congress. Dr. Ronny Jackson, we appreciate you coming on the program today.